Hi guys, Dr. Nicole here. We're doing another series in our Voyage to Vitality. We are going to discuss key things that I want you to know about implants and different questions that I get asked all of the time. So I'm going to break out my board, we'll kind of talk about implants and the very important things that you need to understand if you decide you would like to get one. Okay, so let's talk about some important things to understand about single tooth dental implants. But before we talk about it, I'm going to take 30 seconds to recap what a dental implant is. It's actually three pieces, okay? There's the metal titanium screw, which we refer to as the implant. There's the connector, and then there is the crown that goes on top of the connector that holds and becomes part of the top of the tooth, all right? As you can see, here's the root, here's the crown, so the crowns and the roots with the connector in the center. My 30-second explanation of an implant. So, important things to understand. This is the most important thing, so we're going to start with it first. Number one, they do not last forever. All right, an implant on average lasts 20 to 25 years when you have the best conditions in your mouth. Okay, there are people who are unicorns out there who have had implants for a very long time, even longer than the 20 to 25 years, and they should be celebrated. But most people, it's 20 to 25 years, so they don't last forever. Second thing to know is that you can get gum disease around an implant just like you can a tooth. All right, so why is this important? It's important because you need to brush and floss the implant. I know many people who are nervous about touching anything around an implant. Do not be afraid. You have to keep it clean. You have to brush, you have to floss. Get in there and get the schmutz out. That is the most important thing you need to do, okay? Gum disease can cause you to lose an implant, and it's very important to keep it clean. The last thing to know is that, as you can see, it's three different pieces. Something can go wrong in one of the three pieces. If something happens with the crown could break. You could have the crown come off of the connector, okay? The connector could become loose from the implant. All of these different things can happen. The implant itself can become loose. That's a really bad day, but you just need to know that all of these things can happen, all right? So I'm going to recap really quickly. We're going to start with the easy ones and then go up to the big one. You can have something happen to any of the three areas of an implant. So it's not a seamless thing once it gets put in your mouth. Next thing is that home care is extremely, extremely important, all right? Why? Because you can lose an implant because of gum disease, just like you can a tooth. And last but not least, remember, an implant does not last forever, okay? They last about 20 to 25 years for really well-placed ones that are really well taken care of, all right? As I said, there are unicorns, but 20 to 25 years on average. So if you are going to be living for the next 20 to 25 years, there may be things that we will have to do in the future to replace that implant, okay? Important concept and really, really important for you to understand before you have an implant placed. So if you have any other questions or would like to discuss implants further, please feel free to give us a call, but until then, keep on brushing.